Okay, so as I was saying in the last video there, Broca's area, Wernicke's area, these are all things we're going to talk about more when we're dealing with strokes, and that can kind of give us an idea of areas that we're having in that. And Broca's area basically is going to be a big spot with speech patterns, vocalizations, can be a lot bit different. So again, when we're dealing with strokes, someone may be talking completely normal, but to us, but it's completely abnormal to family. And there's been areas where the Broca area has been affected, where someone now starts talking with a accent that they've never done before. They can speak another language that they've never been able to before. Lots of different things that can happen in that area. So again, important areas. We're not going to go over it too much in this. We'll do it in other lectures down the road. Again, as far as I'm talking about for the brain, big thing that we're looking for is knowing basically big structures. We're going to go into these more in depth into the actual paramedic class. But there's a right hemisphere is basically sensory information, understanding that, where left hemisphere, again, can talk about other aspect of how we work for it. But there's this crossover in the corpus callosum. So basically, anything that's on the left hemisphere affects the right side of the body because it crosses at the corpus callosum as it descending on the track down to the spinal cord. Same thing with right side. Any right-sided area actually affects the left side. So when we get a area of stroke or area in the auditory cortex, writing area, speech center, Broca spot, anything like this on this side, it's going to affect the right. So we have a right side slurring, dysfunction, that the actual clotting side or bleed is usually on the other side. So kind of an area just to go. I'm not going to go over the sleep studies, beta waves, theta waves, delta waves at this point in time. They're basically a good characteristic that can talk about REM sleep, all just a type of things here we can do. There's sleep studies and all those things, but it's not really going to apply to us. So I'm kind of able to skip through all these now. Amnesia, again, we'll talk about this more in forms of when we're dealing with our trauma situations and what can happen and how those are affected. So that's it for this area. Again, the other thing that I want you guys to be aware of is we're going to talk about cranial nerves. So as I'm talking here to get you all set up on this, the cranial nerves is going to be the other aspect that we're going to be doing. And I'm going to go into, while we're talking here, and bringing up another lecture. And the thing I want you to know about is going to be the cranial nerves and how those are functioning. So I apologize here as I'm kind of getting this set up here. This is everything we went to. This is a 200 and some lecture of pathways and everything else, and I wanted to save you from all of this. But again, this is 400 slides now, so much that I've really kind of broke this down into. And I want you to be able to learn these. But the big cranial nerves that I want you to know is I do want you to know all 12 cranial nerves, where they are, what they function. It is an important aspect, especially with our assessment. And so I will get something for you on that if I can't find it on this lecture. But we need to go over those cranial nerves, and that's going to be a specific aspect. And I apologize that it was supposed to be on that lecture that I'm going. So this is how we do in paramedicine: is we adapt, we overcome, we prepare. So we're coming up and talking about the brain again. The main cranial nerves that I want you to know, and I'm going to talk about those here, and I'll just get something else for you as well, is going to be, 1 is the olfactory, 2 is optic, 3 is ophthalmic, 4, wow, cut me off on these two. So 5 is trigeminal. Knowing where 2, 3, and 4 basically work on the eye. Their eye movements, eye adjustments, as well as vision, 2 being optic. 1 is olfactory, which is your sense of smell. So it's being able to test on how those are. 7 is going to be your facial nerve. 5 is your trigeminal. 5 is the muscle of the nerve that affects mastication, eating, all those type of things, chewing. So that's going to be cranial nerve number 5. Cranial nerve number 7 is going to be your facial nerve. That's going to be your smile, your ability to squint your eyes, wrinkle your forehead, all those type of things on there. So those are going to be an important aspect. Those are the ones that I'm really wanting you to know. See if this one here, here we go. This is going to kind of talk a little bit about those areas. So I'm going to focus in on this one and go over that specifically. So this is where I want you to know. So olfactory is going to be 1. Optic nerve is going to be 2. Sorry, I'm going to shift here. This trying to get in focus on here, and this is not focusing really well, so I do apologize. So 2 is the optic nerve, 3 is the oculomotor, 4 is the trochlear, again also dealing with the face. 5 is going to be the trigeminal, that's again mastication. 6 is the abducens. 7 is going to be your facial. 8 is going to be your vestibular cochlear. So that's going to be with hearing, sound, sensation. I'm not too much worried about that. 9 is going to be your glossopharyngeal. 10, I do want you to know, which is going to be your vagus nerve. Vagus does all your stimulation to your heart, your respiratory. It sits down into your spinal cord, so when you vagal down, you're working on your vagus nerve. So that's going to be an important one. Accessory, it's called your spinal accessory, is cranial nerve 11. And then hypoglossal nerve is number 12. And your hypoglossal nerve basically works on your tongue. Allows you to stick out your tongue, position it side to side. So those are the ones, and I do want you to know those. And you can look that up for your other cranial nerve chart list and see. But those are kind of a list. I apologize for the way this was presented on there, but you guys are big kids. You can figure it out, right? All right. Talk to you later.